What made you want to do neurofeedback?
Well, I'm a pediatrician, and I have a patient and her mother who came in, and they were so calm when historically they were everywhere and scattered during our visits. And so I asked them what changed. And my patient was no longer taking her medicine for ADD. And she was sitting on the table, was calm, was able to number her questions for me and speak intuitively and answer questions the way that they were delivered. And she did not have any superfluous thoughts that came to mind, and she was just so organized. And so I asked her what happened, and so she told me about neurofeedback with Stacy and Pathways, and that's why I called and set it up, because I thought if this can make this big of a change in these people's lives, then it can make a change in mine. And I don't have ADD, but I have severe anxiety, medicated so that it's controlled, but I would like to be off medicine, I thought, well, I'm going to try this for myself.
How has neurofeedback helped you?
Neurofeedback has changed my life. I can sleep without being medicated. Those medications were causing brain fog during the day, even though I was getting sleep. Now I don't have to take medication, and my anxiety is extremely low. As long as I get my sleep and take just a minuscule amount of my anti-anxiety medicine, like a fourth of what I was on before, I am stable, I can think clearly, I can number my responses, I can tell the 3 people that I live with, okay, you're first, you're second, you're third, zip it. Okay, what's your question? And I can know when I'm getting a little bit anxious and be able to identify my triggers. I mean, identifying triggers is hard anyway, but you have to cut through all of the superfluous noise in order to be able to do that. And it's much easier to do that after you're not in a brain fog and your thoughts are coming clearly and you're calm.
As a pediatrician, how do you think neurofeedback would help kids who have ADD and ADHD?
Well, just as I've described with my anxiety, I think that those two, anxiety and ADD or ADHD, most of the time go hand in hand. Because as they are being diagnosed, their parents have tried creative ways to parent them, but they probably have problems with their self-esteem, and they are not thinking clearly. They're trying to be obedient to their parents. They're trying to be obedient to their teachers. They're trying to do well in school. They are just stressed out. And I think that this could definitely, I know that it can definitely help kids with ADD and ADHD, but it's also the ones that have anxiety can be calm so that they can think more clearly. And I would think that it would also be a hand-in-hand therapeutic for people who are in family counseling who've had some trauma just because they have a kid with ADHD or usually the parent with ADHD who is not treated.
If someone is interested in neurofeedback, but they have questions, reservations about it, what would you say to them to encourage them to do it?
I would tell them that it is so easy. You come, you learn about yourself, you decide what you want to work on, and then you sit still. That is all you do. There is nothing to have a reservation about. There is nothing to be fearful about. There is nothing but relaxation and feeling better in your future.